Hello, I'm Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Selena Gomez, and I am 31 years old.
Okay, how may I address you?
Please call me Selena.
Okay, Mrs. Selena, today we are going to discuss about your health issues. Will that be all right?
Okay, doctor.
And during our discussion, I might take down some notes which will be strictly confidential. Is it okay?
No problem.
Okay, so now, Mrs. Selena, can you please tell me in your own words what have brought you here today?
For the last 2 months, I have been suffering from body ache and all over my body, especially on my muscles. I feel all the time achy, and it is more especially at night. I thought initially that it might be due to my job stress, and I am working as a manager at a company, and I had to do a lot of work stress. I had to move from room to room. That was some what stressful condition for me. So that I thought that that might be due to this condition, but the problem was increasing day by day, and the situation has came to a point that I even feel that I am getting mass weaker also day by day. And after that, I visited my GP. I told him that I have been having generalized body ache, and for that, I even cannot do my job properly. I cannot even sleep at night properly due to this condition. He also thought that it might be related to my work stress. He gave me some paracetamol tablets, but that condition didn't help me much. It helped me just only a little, making somewhat pain free, but that only for a short time. And rather, the condition was progressing day by day. After that, I also noticed that I am becoming much fatigue, much weak. That all the both problem has made my condition worse, doctor, and I even couldn't join the job for the last 1 week.
I can understand that you have been very much troubled. I will try my level best to find out what's troubling you. Can you please tell me that did your problems come along suddenly, or do you think that it has developed gradually?
Gradually, doctor.
Okay, and do you now feel low all the time, or this problem weak almost all the
All the
time?
time, doctor.
Okay, every day.
Yes.
Okay, and okay, and do you think that it's you feel weak all over your body, or is there any specific part of your body that you feel more weak or more pain?
I feel more pain of my muscles, doctor, especially my
Okay,
hands and legs.
okay, okay, that's all right. I can get it. And okay, and do you think that there is anything that makes you feel better?
No, doctor, nothing.
Okay, anything that makes it worse?
I feel more worse at night. I
Okay,
cannot
you have
even.
told it before. Yes, and have you noticed that is there any specific any other specific time that makes it worse after doing any work or anything like that?
No.
Okay, that's all right. May I ask you? May I ask you some other questions now?
Okay, doctor.
Okay. Do you have any? Have you faced any weight change recently?
Yes, doctor. I lost
Okay.
about 5 kg weight for the last 2 months.
Okay. And was it intentional or unintentional?
No, totally unintentional.
Okay. And may I know how about your appetite?
Reduced somewhat.
Okay, that's all right. I can get it. And have you noticed any lumps and bumps anywhere in your body?
No,
Okay, any raised temperature?
I feel I have raised temperature at night, but I haven't
Okay,
measured.
and okay. And have you had any night sweats?
Somewhat, not so much.
Not so much. Okay, that's all right. And have you faced any weather preference, like preferring hot or cold weather or something like that?
No,
Okay, that's all right. And have you noticed that there is any change in your face? Any change in the shape of your face? Like
No.
it's getting more. Okay, that's all right. Any skin changes? Any changes in your skin, like thinning of your skin? Have you noticed?
Doctor, I had some rash, and I thought that this might be some chemical use. That is
Okay, okay,
why I thought that it was due to some coloring agents or for my eyes, some blocking. I have noticed some changes, some rest like is on my face, especially around my eyes, and some changes on my hands also. Nothing else.
okay, okay. I can get it. I can get it. May I ask you? Okay, that may I ask you some other questions now? That do you have any headache?
No,
Okay. Apart from the rash in your eyes, do you have rashes anywhere? Eyes and hand. Do you have rashes anywhere in your body?
no.
Okay. And regarding that rashes in your eyes and hand, may I know that are they almost same in appearance?
Yes, doctor.
Okay. May I know about the color? About its color?
Somewhat violaceous.
Rashes. Okay. And is it itchy?
No,
Okay. Does it bleed?
no.
Okay. Has it been the same, or have you noticed that it's increasing or in size or something like that?
Increasing a very slowly manner.
Okay. Okay. I can get it. And may I ask that do you have any problem in your vision?
No,
Okay. Any oral soreness?
no,
Okay. Any difficulties with your swallowing?
no,
Any speech difficulty?
no.
Any weakness in any parts of your body?
I feel generalized weakness, doctor.
Yeah, yeah. No, no, yeah, yeah. That's all right. And may I ask you some other questions now? That do you have any cough?
No,
Any chest pain?
no,
Any shortness of breath?
no,
Any racing and pacing of your heart?
no,
Any chest tightness?
no.
Okay. What about your water work?
I think it's fine.
Okay. And have you ever noticed any blood in your water work?
No, doctor.
Okay. And how are your bowel movements?
I think it's fine.
Okay. And have you noticed any lumps and bumps anywhere in your body?
No,
Okay. And have you ever noticed so that any bleeding from any sides of your body? Any
no,
bleeding,
doctor.
like a coughing of blood or something like that?
No,
Okay, that's all right. And okay. And have you ever noticed any dry eyes?
no,
Any dry mouth?
no.
Okay. And uh, okay. And may I ask you some other questions now? That uh, do you have any known disease history?
I had asthma in my childhood, doctor.
Okay. And is it well controlled now?
Uh, I that asthma present about 8 years, and I stopped medication when I was 10, and for last 20 years, I don't need any medication.
Okay. I can get it. And that's a very, do you take any other medication?
No,
Any medication? Any allergy to any medication?
no,
Any over the counter medication?
no,
Any herbal medication?
no,
Okay. Do you take any blood transfusion? Have you taken?
no.
Okay. And do you take? Do you have any significant family history of any similar diseases or any other diseases? Can you remember?
My mother had diabetes, doctor.
Okay. Okay. And at what age did she had it?
When she was 35.
Okay. And was it all well controlled after that? Can
Yes.
you remember? Okay, that's all right. And do you have any family history of cancer? Can you remember?
No,
Any family history of clotting problem?
no,
Do you yourself ever had any history of clotting problem?
no.
Okay. And may I ask you some personal questions now? Will that be okay?
Okay.
Do you smoke?
Yes, doctor.
How many sticks for how long?
About 15 sticks.
Yeah, smoking can be very harmful, and it can also cause your problems as well. So I would like you to stop smoking. If you want, I can refer you to smoking cessation clinic. Will that be all right?
Okay.
Okay. And do you drink alcohol?
No.
Okay. Actually, it's a personal question, but may I ask that do you ever take any recreational medication through your blood channels?
No, never.
Okay, that's very, very appreciable. And may I know that actually these are again very personal questions. May I know that whom do you live with?
Living with my husband.
Okay, and may I know that have you ever had any babies or ever tried to have any babies?
No.
Okay, that's all right. And may I know that do you take any precautions for not being conceived?
Yes, doctor.
Okay, and is it what is it? It's a tablet or pill or anything like that?
It's pill.
Okay, that's all right. And and do you take any other and may I ask you what about the period?
Regular, doctor.
Okay, and may I just ask you some other questions now? That have you felt that you are getting paler day by day?
No.
Okay, that's all right. And you told that you have more pain in your muscles. But may I ask you some other questions? Do you feel any pain while combing your hair or while getting up from bed, or have you felt like that?
I didn't feel pain, but I feel weak during those time activity like
Okay, okay,
getting up.
that's all right. And okay, okay, yeah, yeah. May I ask you that what do you do for a living?
Told you, doctor.
Yeah, yeah.
I'm
And
working at
actually,
office as a manager, and I have to do a lot of work. I
yeah, yeah,
couldn't
yeah.
go to the
Yeah, you
office
have to
for
move
last
from
1 week.
room to room. I can get it. Yeah, yeah. I can get it. And may I ask you that do you think that you're well supported in the home and in socially as well?
Yes, doctor. I think.
Okay, okay. And
No,
may I
it's
know that do you
very.
drive? May I know that do you drive?
Yes, doctor. I have to drive.
Okay. And may I know what your concern is?
Why am I having this, doctor? Is it a diabetes?
Oh, yes, I can understand your concern. At this moment, I cannot tell you for sure that what's causing your problem, but for that, I will have to examine you thoroughly and also do some blood tests and some scanning tests as well. But at this moment, as long as I have taken history from you, I think that you might be suffering from a condition named dermatomyositis. Have you ever heard of the name?
No.
Okay, please don't bother about the term. It's a condition in which there can be your own tissues can act against your body. Okay, and it can affect skin and sometimes muscles as well, and can cause many of your conditions. However, we have to rule that out by doing those tests, as I have mentioned. I will also involve the joint doctor, okay, and skin doctor in this case, and we also have to. We also to form a multidisciplinary team so that we can involve the occupational health clinic so that they can help you with your job, okay, and if you want we will also involve the smoking cessation clinic to help you stop smoking, and we will also
I'm
provide you
up.
a leaflet in this matter, okay. Well, at this moment I would like to do some tests for the patient.
Okay, proceed.
Examinations.
Proceed.
Okay. At the beginning I would like to have a look at the eyes to see whether there is any anemia present or not.
Mildly anemic.
Okay. And then I would have to I would like to look at its face, any rashes present.
Yes. She has rashes over eyelid.
Yes. Is it reddish violaceous? Is it a heliotrope like?
Yes.
Okay. And rashes in the hand, in the knuckles, I think.
Yes.
Okay. Like in every interphalangeal joints, cotton papule. Okay. Papule.
Yes, papillary lesion, but not all over the joints.
Okay. That's all right. And in the mouth, any oral soreness present?
No.
Okay. And then I would like to use the stethoscope to listen to the precordium, especially the apex of the heart and also the base of the lung and the apex of the lung.
Okay. Lungs clear.
Okay, and I would also like the patient to take a sip of water too and feel the thyroid gland.
Okay. Thyromegaly not
And
present.
okay. And I would like the patient to tell to take her both hands over the head. Can she do it?
No, it's difficult.
Okay. And I would also like her to stand up from sitting position without the help of her hands. Is it possible?
Difficult.
Okay. And I would like her to have just a short step walk if it's possible.
Yes, she can walk, but
Okay. And then
limited.
I will I will just again lay her down, and then I would like to look for the both knee jerks, ankle jerk, and plantar.
Plantar, flexor, knees are ankles are present.
Okay, that's all. I think that's the examination. Okay.
Have you received diagnosis?
Yes, I think the patient is suffering from weakness, most likely due to dermatomyositis.
I would like to investigate her.
Well, also, I would like to put some other differentials in this patients as well. So regarding his uh, highly now the mood disordered mood, I think I we should also rule out if it's not dermatomyositis, I think we can also think about chronic fatigue syndrome. Okay, I think uh, although the time frame is not the chronic fatigue syndrome should be at least 6 months. The time is not going in favor of that.
I would like to
But
investigate her.
yeah, actually, at the beginning, I would like to do some basic investigation like a complete blood count and ESR and CRP. In the complete blood count, I would like to look for any anemia and also any neutrophil count or lymphopenia, and then also I would like to do ESR CRP to rule out any inflammatory condition, and then I would like to do some specific tests like anti-nuclear antibody and anti-Jo1 anti-Jo1 antibody, and also anti-ribonuclear anti-RNP antibody, anti-dsDNA antibody, these antibodies. And then I would like to do a high resolution CT scan of chest to find out any chest lesion present or not, and also urine microscopic examination, urine culture, and sensitivity urine ACR, albumin creatine ratio, and if needed, skin biopsy may also be done with the direct immunofluorescence if needed.
Okay. I would like to manage her.
Uh, I think first of all, I would perform a multidisciplinary screen in this patient involving uh, occupational health service, physiotherapist, the psychiatrist, and rheumatologist, and uh, and also dermatologist. And at the beginning, I will have to find out the cause, and at the same time, I would like to give the patient start treatment with the patient by giving her some steroid tablets. Okay, and later on, I will also have to treat the cause. It can be primary, or if not primary, then we have to treat the cause as well.
What are the secondary
And
causes for dermatomyositis?
well, regarding her age, actually, in younger patient, it can be primary, but it's more commonly associated with SLE. But if it's older age, I think it's more commonly associated with like, carcinoma, and most specifically carcinoma of lung. Okay.
Okay, fine, thank you.
Okay. Okay.
Yeah, some points to be highlighted that in the history taking you have asked very good history for body ache, specific body ache, where specifically feel the body ache. You could have asked that she has told that she feels more pain over her muscle. Okay, you could have asked that can you show me which muscle?
Yeah.
Then she could point it out that okay,
Yeah.
more about the larger muscle. Okay, then site. Then onset you have asked that any frequency and duration, if it is progressing, then character of this aching, that it is so severe or not, then radiation, don't have any radiation associated with radiation, then associated symptoms, any changes in the muscle, any changes in the achiness, any swelling over the aching area, any changes in the skin over the aching area, any tingling or numbness sensation, any changes after going to the uh, sunlight area. Okay, you could have asked.
So
Then
swelling over aching, skin changes, tingling, numbness, and changes in sunlight
yes,
all, all over the aching area. Okay, okay.
and after that for timing, okay, any timing
Yeah,
associated with timing, daytime or night time, when does she feel more? Is there any changes in eliciting or aggravating factors? Sometimes there might not be any eliciting or aggravating factor. Then severity of this condition, is taking
yeah,
pain
yeah.
so severe or not? You haven't asked about severity.
Actually, she at the beginning she told quite a lot about her severity. So actually, I didn't repeat it. She told that it was very much discomforting for her. So actually, I didn't ask for that reason. Is it okay, or should have I asked also?
You should have asked because you may need to prescribe immediate painkiller.
Okay, okay, okay. Mhm.
And
Okay.
after that, for the weakness, generalized weakness, you haven't asked which side you feel more weak. Can you give me any example of what do you mean by weakness? Then she would have told you that, okay, whenever I try to get up from the bed, I feel that I cannot. Whenever I try to dressing myself, I cannot do that properly. That is very bothering me. But I can do like
Yeah,
clerical jobs at my work, that is less affected. Okay,
yeah.
and for weakness, any again sight,
Yeah.
onset, character.
Then I would have got the clue at a very early stage. Mhm.
Yes,
Yeah.
and again Socrates for the generalized weakness. Okay, after
Any
that,
other points? What's the timer? Yeah.
timing is associated.
Hello.
Yes, timing is also associated for generalized weakness because some
Yeah.
myasthenia gravis timing is
Mm.
as the day progresses, weakness increases.
Mm. Mm. Yeah.
So timing was important.
I asked about timing. Any
Yes,
specific timing?
yes, and past history I've asked that, family history I've asked that, drug history I've asked that, personal history I've asked that, and
Yeah.
in the okay, in the management plan, these patients need multidisciplinary approach, and multidisciplinary approach should be rheumatologist. Okay,
Yeah.
okay, and in the history taking, you have asked about the all the signs for underlying causes, secondary causes. You have asked for that, and also you have went for the red flag signs. Okay, that was fine. In the
Okay.
management, multidisciplinary approach, rheumatologist, may need
Mm.
occupational health therapist,
Yeah.
dermatologist. You haven't mentioned all of those.
Mm.
Dermatologist, uh, occupational
Okay.
health
Okay.
therapist,
That was a huge.
physiotherapist. You haven't asked, you haven't mentioned all of them. All of those are necessary for this.
Yeah. So
And these patients may need some
okay.
pharmacological management, like for acute flare-up, she may need to go for steroid, and after that, she may need steroid sparing other immunomodulator drugs. After the cause is
Okay.
diagnosed, we will go for that. You haven't told that. You haven't also told
Well. Actually, I told that we have to find out the cause, and at the same time, I would like to start treatment. Was that right, or was it wrong?
patient's condition was severe. She couldn't join the job for 7 days, and you want to go for to find out the causes. That will take much time.
No, I told that at the same time. So I would like to look for the causes, and at the same time, I would like to start treatment. I told in that way. So was it right or not?
Okay, this was almost a completely clear-cut case that this is a case of dermatomyositis. So as soon as you start the treatment, patient feels better, and after that you can do whatever you like.
Okay, okay, that's all right. That's all right. And was it a primary case or was it a secondary case? Did you miss it?
Secondary, sorry, primary.
Okay, okay. Then it's all right because I went through
And,
so
and,
many secondary causes.
and also for the causes of generalized weakness, there are few other causes for generalized proximal myopathy. You should have also
Yeah,
booked that if they are present simultaneously, like uh, hypokalemia, hypothyroidism, or hyperthyroidism.
yeah,
In
yeah.
investigation, you should mention that they might be associated with it.
Okay, okay, okay. Yeah. Thyroid examination must have been told. Yeah, yeah,
And in the examination part, you have went. I think you have went well. You have asked. First, I think you should have started with hands. That we do like peripheral examination, hands, then face,
okay.
then we go for the cases.
Okay. Yeah, yeah. Okay.
Do you want to add
Okay.
anything, or Dr. Haitham? Do you want to add anything?
Uh, yes, please. In the history, we should go through our differential. We should rule out. It's as you mentioned. It's most likely primary. Doctor asked already for secondary to rule out any cancer, but he didn't go through mixed connective tissue disease to look for any additional rheumatology condition. He didn't ask for joint pain, joint swelling, sclerodactyly. Am I correct?
Yes, yes. For rheumatological exam, any rheumatological cases should have go for.
In the history and in the examination,
Yes, he totally missed.
and in the investigation, most important to mention creatine kinase. Didn't mention also.
Yes,
It will be elevated.
creatine kinase, he didn't mention it.
Sorry, sorry. Can you please repeat again? I just missed.
In general, in the history, start with the complaint, then go through the system involved. The system involved here is musculoskeletal, the rheumatology. Ask
Yeah.
everything about. Especially in this case, you need to rule out mixed connective tissue disease, like most likely SLE or rheumatoid arthritis. You should ask for joint pain, joint swelling, morning stiffness, thickening of the skin, skin rash when exposure to sun. This very important. This was missed in the history and in the examination also. In the examination also, you should check in the hind for any joint swelling and for thickening and for sclerodactyly.
Okay.
And in the history also, and the examination to ask about renal phenomena.
Yeah.
And the functioning status and the impact of the disease in the daily living and job, and
Okay.
creatine kinase in the investigation.
Yeah, yeah, yeah. Creatine kinase. I just missed it.
I don't remember the serology for dermatomyositis. What is the specific for this disease?
I think anti-Jo one. I think I have also not cannot remember fully.
Yes, Joe for polymyositis,
Yeah.
JP.
More specific for polymyositis than dermatomyositis.
For dermatomyositis, me.
Okay. It is B. So what?
Me. Me too.
Oh, okay, okay. Yeah, yeah.
Okay,
Okay.
thank you.
That have another name. I forgot that name.
Okay, I don't think that it would be a very big issue. If we forget, just we can tell about the antibody study. If you forget.
Extracted nuclear antibody.
Yeah. Okay.
Okay, and who want to go for the next case?